So welcome everybody back to the SAP-E workshops. Today's topic is national stroke plans and implementation of national stroke plans. This is really a cornerstone in the work for action plan for stroke in Europe, because basically what is happening with a national stroke plan is that it assists in ensuring good quality stroke care, but it has to not only be implemented but also be funded to work. So when I talked to many of you earlier this year in the one-to-ones, many of you had already initiated this process, going from many different angles. Some had set down a writing group, some had initiated discussing with the authorities first. Many are trying to do this and focusing primarily on the acute phase of stroke and not the entire chain of care, and some on the hospital-based care only. What we're going to present here today is the magnificent work by Fabrizio Pinacci and Francesca Romana Pesella to set up a national stroke plan template and guide, which they will go through. And then afterwards, we will go into a breakout session for discussion of major topics in this, so that we can improve the draft template, but also, and most importantly, so that you can both share your experiences with starting to make a national guideline, but also you can hear other people's experiences and have some advice on this. So thank you very much for attending today. And it's now my pleasure to give the word to Francesca Romana Pesella, well known by everybody here, I am sure, who will present a national stroke plan definition and objectives. And now for you, Francesca Romana, please.
Thank you very much, Hanne, and it's really a pleasure for me to be here with you today and sharing with you the National Stroke Plan and the documents that we have produced together with Fabrizio Pinacci in order to try to offer to all the participants of the SAP-E a useful tool or a useful resource that it can be put in place in each country by the national coordinators. As Anne just said, next slide please, the national stroke plans are the cornerstone of the implementation of the SAP-E for each country. It's one of the overarching targets to have a national stroke plan to encompassing the entire chain of care from primary prevention to life after stroke. And of course, within the National Stroke Plan, there is the opportunity to implement the national strategies for multi-sector public health interventions, promoting and facilitating a healthy lifestyle, reducing environmental and socioeconomic and educational factors that can increase the risk of stroke and stroke mortality and stroke disability. So as you can see, we have come now probably to one of the most, I would say, most important point that could have really a social economic impact on our activities, and it's probably one of the activities that needs to be undertaken with a multi-professional and multi-dimensional approach. Next slide, please. So next slide. We try to give a definition of a national stroke plan. What do we really think it is? It is a statement. It is an organizational statement of different elements such infrastructures, human resources, funding, IT system, and procedural documents that are needed in order to implement stroke care at its best. their relationship, their objectives and goals that serve as a basis for setting up an operational plan and gaining consensus of interested parties. And of course, when we say interested parties, we think of all the different stakeholders concerning stroke care. And among the different stakeholders, of course, there is the civil society, which has a really pivotal role in this in a successful implementation of the SAP-E and so of the national stroke plans. A national stroke plan should include a national stroke strategy, should include, and the parties that are involved should be clearly clarified and defined. The outcomes and targets of all coordinated actions that are used to achieve the objective of the SAP-E in the single country. So as you can see, it's a very much single country, single nation based vision that it's at the same time would like to has the really high, let's say, ambition to integrate with the rest of Europe. So it's quite a complex process, but we have at least 10 years from now, 9 years from now to achieve, to do it. Next slide, please. When we think of the purpose of a national stroke plan, of course, and we think and we try to plan it successfully. And of course, we have to keep in mind that each country has different priorities, and so there are different actions that should be planned and should be undertaken to achieve the SAP-E goals and the SAP-E objectives. So first of all, I would like to make some examples. Goals is what we what we think, the way we define goals is the end result of the national stroke plan. So an example in this case would be like the treating 90% of more of all patients with stroke in Europe in a stroke unit as the first level of care. So this is one of the goals that we should have, that a national stroke plan should have. The outcomes are more a prospect situation that we would like to achieve, the to-be picture at the end of our journey together. An example is managing and delivering stroke care by competent personnel. With personnel with expertise in stroke, creating plans for effective recruitment of this personnel and training of this healthcare personnel. So you see, it's more it's a vision, and of course is a more is a very complex somehow to achieve, because there are different objectives that we need to reach in order to get to arrive to this outcome. And so we come to definition of the objectives that we have in this in the document that you will read. In this case, objectives are what are the gaps that exist in the single nations, and how we are going to fill them. And an example is, for example, is very easy, is in the structures, the number of stroke units that need to be established in a single country in order to grant to the 90% of patients with stroke to be treated in a stroke unit environment. And of course, the outcome is to manage the patient and to deliver stroke care by competent personnel. So it's a more capability building, more capability building outcome that we want to reach. And of course, this is a complex vision, but as I said, we have time and we have different actions that we can put in place at short-term actions, medium-term actions, and long-term actions in order to achieve the full implementation of the SAP-E in Europe. Next slide, please. As you remember, we sent to all of you a survey on acute stroke care in Europe. And one of the questions that we asked for you to answer is, what if there were an existing an existing national stroke plan in your countries, if you were already working on this. And this is Hanne mentioned that in her introduction, that she had the opportunity to discuss with each one of you. And so there were the national stroke plan were at different stages in the different countries. So with this tool, we hope to offer a possibility for those that don't have a national stroke plan yet to use this tool, to use this template in their own country, discuss it with the national authorities, and use it to build up a national stroke plan. For those that already have a national stroke plan, I think it's very useful for them to confront what is already in place, and probably also inform the template with their experiences in order to make
Oh, we seem to have lost Francesca.
No, I'm here.
All right, okay, we're back.
I don't know, Leslie, yes, sorry. So as you can see, there are more countries that don't have a national stroke plan and less countries that already have it. We know about very positive experience in the UK and Ireland, and recently also from Catalonia. And it's going to be very interesting to discuss with all of you in the separated rooms, not only your experiences, but also what you think of the document, of the template document that has been shared with you when we sent the invitation to this meeting. Next slide, please. So here you see on your right-hand side the structure of the template document, which is in 4 boxes. And we will, Fabrizio Pennacchi, we will discuss this structure with you in the next presentation. So this template is a framework to support you and, of course, the national authorities, and to support the process of implementing the plan. And for those that already have it, is a framework to confront what's already in place and see if there are gaps, or also informing us and the template with good experiences and model to reproduce. Next slide, please. We have come to the end, so my recommendation is to engage and be involved in the activities. The SAP-E Executive Committee is here to help and to answer all your questions. So I'm really looking forward to discuss this with you in the groups. Thank you. So now, Fabrizio, the floor is yours.
Okay, good afternoon to everyone. I'm taking from the part where Francesca left. It is clear that the national stroke plans that were prepared in those 15, 20 countries that already have one or are producing one are not done exactly in the same way. We are a large initiative, is involving a huge number of projects. So we wanted to start by giving additional instruments. Next, please. Okay, we wanted to have a national stroke plan document for the SAP-E that simply had to fulfill these 5 needs. Provide a clear description of the projects in every country for all parties to understand and agree upon. Please, I observed that many stroke plans around may not be scoring maximum level of fulfillment of these 5 objectives. So we're trying to be more encompassing. The second key objective is to keep a complete and consistent records of facts, information, decisions made by the national teams. And also document the rationale behind the expected results of the plan. it is important that this is discussed and recorded, because we want to be able to go back once we proceed in the years and check back with what we wanted to achieve. Third objective is to list and describe all changes to the context, external to the internal context of the projects, that can affect the terms of the delivery for the SAP-E initiative in any country, and how they impact the national plan. Also, we wanted to have a live document. I've seen some regional stroke plan documents that were prepared in Italy. They fundamentally are a projected, let's say, ideal image of what stroke plan in a region should be, but they are not live documents. They need to be completely reissued and reinstated, let's say, every 3 or 4 years, because they tend to remain static in the way that they are designed. Instead, we wanted to have at glance all things that we knew, all things that have happened in the meantime, and how we wanted to arrange for managing these events. Last, we wanted to have a place where to collate the work input of all the participants to the project. Initially, let's say, the work of the national coordinators, as we have discussed last year in the list of the tasks for the national coordinators. So we want to have here the national priorities, the development goals, the stakeholders map, and also be able to reconcile the national strategy against the SAP-E targets. Next, please. Also, by speaking with the SAP-E Executive Committee, I understood that we wanted to give 3 things to the various national teams. Either they having or not having a national stroke plan document in place, we wanted anyway to give some guidance. Guidance for what? Let's say this initiative is of an unparalleled level of complexity. And assuming that not very many of us have gone through such large initiatives, so we wanted to help teams in organizing their structure and their work already in a way that was functional to achieve the objectives. So we provided a self-descriptive document. In each section, there's an explanation of what it is expected to fit inside the section, with examples about content where applicable, and also with indications in cross-referencing content between sections, whether also this is applicable. Also, we wanted to give structure. Why structure? It is important that the work done in the various countries and regions within a country can be, let's say, mapping against the same organization of content. This will simplify many things, allow also to verify the quality of the national stroke plans for completeness, consistency, but not only that, even for the fact that they, for example, are maintained over time, that they are recording the various changes when is necessary to do it. Also, we wanted to be able to aggregate information from the various countries, so to have the same section in the national stroke plan documents in 10 countries to be able to clip out the content of a certain section and then make a comparative study if it is necessary to be able to share experiences. And this leads to the third key objective that we can achieve through some structure in the work to be able to compare challenges and solutions that were faced by the various teams, thus improving the support that the SAP Executive Committee can give to the various teams, and also stewardship in case problems are found that are not of immediate solution in a certain place. The same problem could have been found somewhere else and be faced in some way, and the experience can be, let's say, shared to take advantage and accelerate the resolution process. Last, we wanted to give reference. So why? This is a document, as we said before, that should be considered a live document. So a standing document that is updated with some level of frequency. Everybody at any point in time can go back to this document and be able and reconstruct the history of a certain decision that was made, the reason why certain decisions were changed, or why certain decisions were made in the first place. And allow all members of the national teams and all the stakeholders, independently whether they were induced in the National Stroke Plan at the beginning or not, to have a shared and consistent historical trail to which to refer to when they have to, let's say, participate in meetings and other things. Next. Okay, so we organized the document in sections. One of the last slides presented by Francesca was in fact sort of a summary of the index of the document. So sections compared to the chapters in the book, in fact, in this case, they may be a bit more complex. And also we have to consider that the document will build over time. So we don't want to perform unnecessary changes in certain sections, but also, but instead to apply certain information in places which are precisely identified. So from the moment the declaration document is signed, the national stroke teams can start already populating this template for what is relevant in their country and regions if the healthcare system locally is organized in such a way, federal or regional model, to start producing like something that looks like a contract. We don't have to think about a necessary obligation, but we want to have somewhere recorded what are the terms that this project will have to respect in a certain place, geographical area or country. So you should get inside all content relevant to the objectives, the responsibilities, the timeline, the prospect costs, the method of delivery, and what are the interested parties, exactly like we do in the contract. Obviously, there's no legal involved in all this, but it's good to start with that approach in mind. The contract is not carved in stone. We can change it, we can adjust it, we can reflect what is happening in the context around us, but also what is happening internally. Imagine having initiated a project like this in a pre-COVID situation and having to face 2 years after a profound disruption of the model that we had in place at the beginning. We wanted to have somewhere where to refer to and be able to trace back what has been done. So we can group those sections, which are roughly 15, in 4 blocks. The first block, the top one, which is large because it's a larger number of sections, outlines the plan context, external and internal. These sections have to be prepared first because they require preliminary endorsement by the plan sponsor and the national authorities. By plan sponsor here, I include the concept of who's making this happen. Either a scientific society, a professional association, a combination of these together with the stroke support organization, or even more regional authorities that participate in the implementation. All these parties need to agree on what needs to be done before starting. Otherwise, we run the risk of creating false expectations and starting to do things which are not then to be completed according to what were the initial objectives. There's a second group of sections that instead seems shorter, but in fact is pretty thick when it gets to compiling, that refers to the prospect timeline benefits and needs. Let's say timeline and needs, mainly because most of the benefits are described in the previous sections. But imagine this, we want to be able, once we have an agreement of the plan context, what needs to be done, what are the objectives, then we have to say, what does the national team need? What does it need in terms of time? What does it need in terms of people? What does it need in terms of funding? What does it need in terms of infrastructure? Do they need a common location where teams can meet and work daily? Is it more, let's say, flexible type of arrangement? All this needs to be described in the document. The same way for all parts, all the resources, including timeline resource, but let's say the needs can refer to skills. What type of skills do we need? One thing that is clear to me, coming from a non-medical background, is that we were able to come up with such a structure of document because we were making use of skills which are not normally found everywhere, especially in a hospital. So it is important that we consider carefully what do we need to have in order to make these things happen, and whether is it going to be easy or complex to achieve. The more complex is to achieve the availability of certain skills, the higher may be the cost or the recruitment time. The third block of sections, and once the context is clear, and I've added here a note in red, is not carved in stone in this one, but ideally before the official mobilization of the project national team, is to have sections confirming the rules with which the plan becomes a project or a collection of projects, let's say, a confidentially named program, which is a combination of multiple project initiatives. Also, what is the breakdown structure of the activities? What needs to be done first? What needs to follow the first thing completed and cannot be initiated before the previous one is completed, or what needs to be completed anyway if you want a certain block of things to be all considered complete. The team's organization and all the accountability rules have to be established. I say, therefore, that preferably we want to have this done before the official mobilization of the project team, because we want to be able we want them to be able to go back to this document and understand exactly what is expected from all teams. Then, shortly after the project has started, shortly can be a period of 6 months, 1 year, but not that long. We need to complete also content in their first version of the last 3 sections of the document. So we want to have a communication strategy document. We want to have an issue management process described, an inventory of all problems and issues that have been happening, to record all actions that were taken to manage them. And also we want to have a risk log. It is important all these things are kept on paper and are kept together, because cross-referencing one with the other is crucial. Example, a risk, maybe a risk for 3 years, then it materializes, it stops being a risk and it becomes an issue. So it needs to be moved from one part to the other one of the document, because things happen, and when they happen, we need to manage them. Next slide. Okay, so we are getting to the specifics. Okay, the first group of sections is the national plan context. we want to have a plan statement that indicates background. So where do we start from? What are the challenges, the shortcomings, what needs to be done, why do we need SAP-E to be implemented in a country, and to what extent, what are the goals, the outcomes, and the objectives, and all work components. Imagine, do we need to implement IT systems? Do we need to have new training programs? All these are separate work components. They may not be long to the same work that we do in hospitals, for example. And we want to have a scope statement and say, okay, these are the boundaries. We don't go beyond this line, because beyond this line, we have other teams, other parties following up. We want to have a national strategy. This was discussed also with Francesca, as you have seen. So we want, wherever a national plan already exists, we want to reflect that content inside this section of the document. We want to have a strategic outline, the level of commitment by the authorities. If there is any assumptions related to regulatory or legal framework, we want to have a business case here, because we want to be able and understand to what extent are we ready to pay the price, in quotes, for implementing this. What are the limits that the authorities are able to support in implementing new changes to the stroke care. We want to have the national and regional stakeholders inventory. We want to have the project scope in terms of boundaries, as I said, also integration. So if there are multiple work components, how do they relate one with the other? Are there any dependencies, for example? And also navigation rules. So processes and rules to manage what is happening in the context, issues and risks, and communication example. Then second last, we want to document the project organization and the governance model. This, you go to the document, there's a pretty long description about what needs to go in these sections, and the key principles, assumptions, and constraints that we need to document. Principles are the rules that we want to follow, our aim, our north, the things that we are not ready to do differently. The assumptions are what we have to rely upon, that we cannot supplement in case it fails at one point. And constraints are the boundaries to the project action. So anything that we cannot exceed. Next slide, please. Going to the second block of, let's say, sections, we have one on timeline and targets. So we want to describe here the project phases, the key tasks, the foreseen duration and dependencies between these, and how the work streams connect with each other. Remember the concept of integration. Also, we want to be able to visualize the critical path of the project, which is the shortest, let's say, the shortest sequence of dependent activities that cannot be compressed and that we have to maintain protected. Let's say, so building, I don't know, contingencies, building time slack in the plan, because any delay on critical path item can have a knock-on effect on our ability to meet the final timeline. A Gantt chart, which is the usual plan representation, also is useful. To be noted here that milestones are important to establish to help visualize the progress in achievements of the national plan. This cannot be, let me identify 100 milestones. It doesn't work like that. We need to select items to make them become milestones because they are visualizing items that we can take stock of and move onwards to another task. And that we especially can map back again the SAP-E targets. So a milestone cannot be, I completed my vacation period. No, it must be functional to achieving the targets. We want also to have a section that I'm splitting in two parts here. So it's probably going to be reflected in the next version of the template. Identify resource requirements in terms of what do we need in terms of workforce, how many people, how is it organized, the organigram, the specific requirements for each role in terms of seniority, competency, the sourcing, and even the type of assignment. Imagine, is it a full-time job? Is it part-time? Is it, I don't know, half a day once a month? It is important that we also put our brains into it. Connected to the resource requirements, obviously, there's also the budgetary requirements that do not relate simply on the human resources that we need to mobilize. Many can be lent by the authorities or by hospitals, but many others may need to be hired, and hiring resources is a cost. And to face this cost, and also the cost for building IT systems, for running training programs, for keeping communication work going on, all these costs will need to be summarized and analyzed, because they need to be approved before we move forward. Next. Okay. We got to the part in which we talk about the rules breakdown and accountability. What do we need to have here? We want to be able to document the project of work, describing the approach to the project. So how do we want to organize our work? Why? What is the objective of each phase? What key results we are going to attain? Or if it is not a result, what documents are going to be produced? What systems are going to be delivered and distributed, etc. Talking about deliverables, especially documents, but not only, we want to be able to have a list of these deliverables, because we want in a certain country where we have a federal health care model, for example, or regionalized, we want to be sure that all regions follow the same list of key deliverables, because we want them to be accountable for delivering results in a certain way. Then we want also to map roles and responsibilities. So for each role in the organigram, I'm not saying, let's say, the project manager, but I don't know, the audit committee, the national steering committee, the training team, the IT system team, etc. We want to understand exactly what are the responsibilities, and need to be articulated in terms of scope component. So on what are they working, what level of authority, whether they plan or not a certain activity, whether they execute or not certain activities, whether they monitor certain activities. A graphical representation of roles and responsibilities can be done through a RACI matrix. It's a tool, and it's described in the document, that makes possible to visualize and evaluate for non-duplication the distribution of responsibilities over the team, and make sure that we have one specific role accountable or responsible for delivering certain pieces of work. Lastly, we want to have here the project measure. So the list of numeric data types to monitor through the project lifecycle. What are the rules about data sources? And these may be very different from country to country, and even between regions in the same country. We want to have information about quality criteria, trend analysis, and data dissemination for the project measures. And we also want to be able and have visualized the indicators. So the SAP-E KPIs at national level, their context, so where are we starting from, how they're calculated, and any intermediate targets that exist between the declaration signature and the year 2030. And also, what is the role of the National Audit Committee in managing the project measures? Okay, next slide and last, I think. Okay, these are the sections that should include at least, as I said, the communication strategy. There are sections in the document that can be recognized because they are represented in landscape mode, because they accompany tables, large tables that are better fitting, let's say, over multiple pages if we look at them in landscape modality. So for every stakeholder, we want to have a list of the communication channel, the type of communication, why are they involved, the frequency of update, and who is accountable, and also comments about the data details backing up this communication, and qualitative engaging messages, if there is any. For example, I don't know, an information campaign to raise funds to support certain activities. So what engaging messages, who is going to be able to or responsible for identifying them, and even identification of the specific focal points, name of people responsible for every type of stakeholder. Going along, talking about issue management, we want to have for each problem a log that is to be reviewed periodically. I suggested that the entire document be reviewed at least every 2 months between now and the end of 2030 to review even the list of problems and dealing with each of them. So understanding who raised it, what is the severity, what is the impact prospect of the issue, and the actual one when the issue is resolved, the discussion point and the decision made, and who is accountable for managing the issue, any progress, and for those issues that are resolved, the resolution date. The reason why we log also this one is because we want to be able and start moving forward after an issue is resolved and take care of other things. But it's also possible that issues resurface at one point. So we want to be able and understand what went wrong, when did we close it in the first place, and why things have happened again. Similarly to an issue log, we want to have a risk log. So we want to have a section that describes how we're managing risks, and for each risk that has been identified, when and who did it, what is the severity of the risk, the likelihood to happen, and therefore the priority with which the risk needs to be managed. There may be things that are very unlikely to happen, and so we may put on the back burner, but there are things instead that are high chance of happening that we may want to look at before. Also, we want to have words about the management strategy. So we're going to avoid the risk, mitigate the risk, manage the risk. And then we want to have information about what actions have been established, what are the possible escalation steps that were taken or may need to be taken, the accountability, so who's accountable for a certain risk, the evolution of the status, and possibly the closure date. Now, I'm not sure whether I was inside the time slot that was given to me. No, I think I went well beyond. So apologize and give back the word to Anne. Thanks.
And thank you very much, Fabrizio, for the excellent work you've done for SAP-E with working on the template for the National Stroke Plan. We're going to move fast as possible forward to the regional breakout sessions. I think it's important that we have this discussion in spite of us being now 14 minutes late. So we will reduce the Q&A at the end. I will reduce the time for wrap up, and then we will still keep 30 minutes for the breakout sessions, because this is a really important discussion. We will automatically, before we move forward to that, there are a few changes in who will be in the groups. The mediator for North will be Diana, and Yannicka will take notes. In East, Christina Tui will be the mediator, and Yuri Florin will assist with taking notes. South, Francesca Romana will mediate, and Rovje Budunicevic will take notes. And last but not least, in West, Arlene Wilkin will mediate, and Katerina Fonseca will take notes. So let's move forward, and thank you very much for your cooperation also in changing of these plans.
Want me to do it? It's recording, closing the rooms, and they're coming back. With a 30-second delay. So back in 15 seconds.
Hello, everybody, and welcome back. We have only a short time to finalize this. I think we just want the representatives from the 4 groups quickly to post their main comments, so that we have a chance of knowing what everybody else is talking about, and because we need to finish on time. So I would like to give the word to Yannicka from the North group, because I'm starting from North and then going downwards. Would you please share your screen and give us the main points from the discussion in North?
Thank you, Hanne. I'm not going to share, but tell you what we have discussed. First, we discussed that how the plans are going in our countries, and we realized that everybody has worked, and for example, in Lithuania, they are in the phase of approving the management plan in the hospitals, and in UK and Ireland, for example, they are updating their national stroke plans. So we discussed about the template. Is it useful? And we think that this is, of course, useful, but it's somehow difficult to understand for some physicians, but also patients and stroke survivors. And there was a suggestion from a patient representative that we should have at least one page translated into lay language to be understand for everybody. So that was basically all we discussed.
Thank you very much, Yannicka. And we will quickly move forward to East, where Yuri, you have taken notes.
Yeah, thanks for that opportunity. We also haven't prepared this slide, so I will tell you the summary of our discussion. In the Eastern region, countries are at different levels. Some of the countries are more advanced, some are slightly behind. And we want to thank Francesca and Fabrizio for their efforts. Should be highly commended. We appreciated it, but general impression was that it would be a challenge to prepare such a large-scale document, and even more so to implement it. Maybe it could be broken down to simpler parts like phase 1, phase 2, and phase 3, so that every country can focus on the most relevant tasks, like setting up infrastructure for stroke care, collecting data, and focusing on quality, and so on. As concerning the stroke plans, the situation is also very different. Like in the Czech Republic, they have had this stroke plan for about 15 years, and they just needed to renew it. In many countries, there are no formally prepared stroke plan yet. And we also discussed the role of stroke support organization and their availability in the countries. Most countries of our region have their stroke support organization, except for Hungary. And in the Czech Republic, there is even a coalition of stroke support organizations. So there are many of them, and they communicate. I also would like to mention the situation in Poland. Professor Kobayashi said that they had prepared a white book of neurology, about 300 pages, highlighting their main needs and strategies to develop better neurological care in the country. And they are currently in progress of revising their guidelines. They have national guidelines on stroke. So that was our impression. Thank you.
Thank you very much, Yuri. Before I give the word to Rove, I would kindly ask all those who took notes to send their notes to Megan at head office. And Rove, I hope I'm saying your name reasonably correct. Sorry. I would like to know what your impressions were from SAPS.
I think that we arranged that Francesca will give this notes.
Yeah.
Sorry,
Hannah,
Francesca. Sorry, I didn't know. Please.
Okay.
Yeah,
Okay.
sorry about that. Maybe I skipped some mail, but we had a fruitful discussion. 5 countries represented. Very good news from Serbia, where today or maybe tomorrow they are going to sign the declaration. So this is exciting news. Concerning the national plans, so there are national plans in Cyprus. There is no national plans. In Croatia, there is not, but not in place. But those have been proposed, has been written as a proposal from the Stroke Society. So there are discussions going on among the national authorities and the stroke societies, which are very active in these countries, including Serbia, Croatia, Cyprus, etc. In Italy, we have 21 regional stroke pathways, and which are more focused on the acute care than rehabilitation, life after stroke, or prevention. A very good suggestions came from Harvey, which is to write a letter from the SAP-E, from the ESO, from the SAP-E Executive Committee, encouraging the countries to the Ministry of Health, and maybe this is something we could study together with the WHO, since we are their partners, is to write a letter to encourage them to have a plan for stroke, or if they don't have it, or if they have it, to acknowledge that they have a plan, which is very good thing, and maybe that that we just hope and that these plans can be renewed, update, and that also integrate with all the actions that are important for the improvement of stroke care. So these were the most important things from the South Group. Thank you.
Thank you very much for this very useful input from South. And then I would like to give the word to Katarina Fonseca, who will give the input from West. And then afterwards, in the last minute, I will give you a little bit information on how we proceed. Thank you.
So, 3 countries participating in the West reunion: Belgium, Catalonia, and Portugal. Regarding the status of the National Stroke Plan, Belgium has no plan, but has some defined actions. The Minister already has a declaration. Catalonia has a National Stroke Plan that exists and it's annually reviewed with aims, and audits are periodically done. And patients are key stakeholders in this National Stroke Plan. Portugal has currently no plan, but the declaration was signed. We talked about how could we plan to implement such a plan. We talked about barriers to overcome. One of them was funding, namely funding for the workforce and to establish an organization. Possible solutions was funding coming from the government or from stroke support organizations. We also talked about the need to engage the patients, and probably a solution is really to involve the National Patient Stroke Associations and talk about issues that directly are relevant to the patients, things that they really think that are very relevant and important for them, like rehabilitation. We also concluded, and we also think that this is not a short-term project. How can we include the entire pathway of care? We thought that is really important to involve all the stakeholders, like health professionals, not only neurologists or internal medicine doctors, but also patients and the government. The government may be very helpful regarding funding and establishment of registries. It's really important to involve patients early on. They should give their input for the stroke plan. They can plan activities, and they are really very relevant for the chronic stroke phase regarding also rehabilitation. We think that's probably easier to include the acute phase. Regarding the feedback of the document, it's really very important to ensure data collection that can be either done by registries or audits. We also think that when we see it for the first time as a whole, it may be daunting. So what we think is probably better just take it easy. Like you said, probably divide the plan in small actions, and it's achievable on the long term. It's really important to don't give up.
Thank you very much, Katarina, for this very helpful input from West too. I think we've had a lot to think about from your feedback. We will have the notes sent, and we will try to follow as best as we can the recommendations you gave. Now, I just want to give you the information that we'll have our next workshop on the 18th of January. The topic in the next workshop will be, oh, you already have that one there, and that is the stroke service tracker. And a link and the actual stroke service tracker should be sent to all the national coordinators around at least around end of December, so that you will already have the tool with you before we have this discussion. And then I just want to tell you that we're not only going to implement your feedback into a continued plan, but we also want to remind you that you have the option of contacting one of the chairs or head office if you feel that we can somehow by advice help you to proceed in the plans for having stroke plan, for following the action plan for stroke in Europe. And with this, I would very much like to thank you for your attendance to this meeting. It's been a pleasure. Please contact us if you feel we can assist. We will follow up on the development in the countries, and looking forward to seeing you in January. Bye-bye.